Hi, I'm Kathy B. Welcome to YourHealthUpdates.com. I'm here with Dr. Matthew Rowe, an Upper Cervical chiropractor, and he does things a lot different. Dr. Rowe, if I was coming to you with lower back pain, how would you handle that?
Well, Kathy, as an upper cervical chiropractor, you know that we do look for things a little bit different than your traditional chiropractor. Our thought process is that it all starts from the head and all the way down to the feet.
That makes sense.
The top two bones in the neck control the rest of our spine because our head sits on it. The head's like a bowling ball sitting on top of a broomstick. The average human head weighs about 8 to 14 pounds. So if it's leaning off side, one side or the other, it can affect our posture in different ways.
Sure.
When these bones shift, twist, and turn out of place, what happens is the head goes with it. Well, the brain has a reflex called the righting reflex, and its sole purpose is to keep the head, the eyes, and the eyes level with the horizon.
Okay.
So if these bones shift and twist and turn and it throws the head off center, over time the body's going to compensate. So we're going to see a shoulder raise, we're going to see a hip raise, ultimately resulting in one leg to be a little bit shorter than the other. These over time, as we walk around 5, 10, 15, 20 years in this compromised position, can actually cause our discs in our low back, our discs in our mid back, and even in the neck to start to thin. This is where we see the degeneration. So it can pretty much get us from head to toe.
Okay, so do you see patients of all ages? I mean, people, say for example, somebody's had these symptoms for 30 years. Is there anything you can do for that?
Oh, absolutely. The biggest thing is we've got to determine what's going on up here in the neck.
Okay.
If we can figure out exactly how these bones have moved and how that head's leaning over and where that posture's affected, then many, many times we can actually help people get through these back pain symptoms. The biggest thing is we've just got to get the alignment. So it's kind of like your car tires. If we've got 60,000 mile tires on our car and we're riding around with perfect alignment, we're going to get 60,000 miles, correct?
We should.
All right. Same thing with our body. If we've got 60,000 mile tires and we're riding around in the improper alignment, then it's going to wear out quicker. That's where we see the aging, what they call the aging process. That's where we see that degeneration come in.
Okay. So would a patient have to come to you on a regular basis, or once it's fixed, it's fixed?
Well, as an upper cervical chiropractor, one of the things that we pride ourselves on is we actually give less adjustments, or we call them corrections, than your traditional chiropractor. Once we get the head and the neck in the proper alignment in a gravitational field, many, many times we can get you to actually hold your corrections. And that's the cool thing about this, holding is healing.
Okay, very good. So I guess we can say that Dr. Rowe helps people get their head on straight. Thank you, Dr. Rowe. Appreciate it.